We're on your side with tonight's cover story, a path forward. March 11th, 2020. That is the day our world, our country changed. The highest level of alert was put into place by the World Health Organization when it declared the COVID-19 pandemic.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Well, in the weeks and months that followed, the virus, we know, it just devastated communities. We can show you some of the numbers here. They really are stark to look at. Complications from COVID have killed nearly 7 million people while infecting more than 750 million. Earlier this month, the WHO marked an end to the pandemic. The Department of Health and Human Services then followed. So what does this mean for you? Our Brandon Hamilton talked with the Mecklenburg County Public Health Director about what the next steps are for the county and its priorities moving forward.
May 5th, 2023.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
This declaration is made from the World Health Organization, ending the COVID-19 global public health emergency more than 3 years after the virus ravaged communities and took countless lives across the world.
It doesn't mean COVID's over. It doesn't mean COVID's just miraculously gone away. It means that we've got the tools at place to respond on a routine basis, and it's no longer in an emergency status.
We asked Mecklenburg County Public Health Director Dr. Raynard Washington what this means for residents and the county. He says the WHO's decision won't have a huge impact, but there are some resources covered under the emergency that will no longer be available at no cost. What are those things?
Sure, yeah, so first and foremost right now, as a result, no longer our health insurance company is required to cover all the costs associated with COVID care. So cost sharing was one of the restrictions that were put into place as a result of the emergency declaration here nationally. As well, you will see the availability of vaccines. The cost of those will also, at some point, will become privatized. Up until this point, the federal government has purchased all the COVID vaccines that have been administered, and so they have been administered at no cost for the actual vaccine to residents. And so we don't know what that cost will be yet, but there will be some costs associated with that as well. You'll also start to see some differences in information that's available to folks because with the ending of the emergency, data that has currently been required to be reported on every COVID case is no longer going to be required, and so we won't be tracking cases as closely.
So how does this, the pandemic, that COVID pandemic we just came out of, how does that prepare you for the next thing?
So, well, I think as a public health system, I think one thing that everybody has recognized, both here locally at the state level and nationally, is that our system continues to need more investment as a public health. The infrastructure to be able to not just respond to emergencies like COVID, but to be able to, again, do our basic mission of protecting and promoting health and do so in a coordinated fashion across all the players who are involved requires intentional investment. And for years, public health investments have been just decreasing in many ways.
So when we talk about the path forward, you mentioned there's things you all can now kind of focus on, and there are some of those you can
specific things, yeah,
can give away.
It's no major thing. I mean, so everybody knows that our health priorities remain the same. We're focused on making sure people have access to health care and the resources that are needed to be able to live a healthy life. We're working on making sure that our communities have access to things that make living a healthy life easy, and I think it comes as no surprise in some places in Mecklenburg County that's not the case. So things like access to healthy food and having a place to safely recreate, living in a community where you feel safe, addressing the trauma associated with experiences that people have every day. All that work is continuing in our department, providing supportive services to families through WIC, clinical services through our clinics, optimizing how we do all that work and perfecting that, improving it, doing it so with a spirit of excellence is really, again, back to what we're focused on.
Dr. Washington says the health department also faced its share of hurdles during the pandemic, from burnout to employees leaving altogether. A COVID response unit supported by county leaders, he says, allowed the department to dedicate resources to the virus.
As a health director, with your background expertise, what do you tell people who, we've pretty much all gone back to our normal activities, and you kind of, COVID is an afterthought, but obviously that's not the case.
It's not true. So I always say, and this is what I said to our staff, with the ending of the public health emergency, it's kind of a sentinel event for us that have been working in COVID response for so long. It doesn't mean that it's over, though. So COVID is still here. It's with us. And, unfortunately, we lost a young child just about a month ago due to COVID-19. And so people are still dying here and across this country and across the world due to COVID. And so this signaling of the emergency ending doesn't mean that it's not still an important healthcare issue, and it does not mean that it's not something we still have to respond to. It simply means that we've got so many tools in our toolbox that it is now we're able to respond in more of a routine manner.
Reporting in Uptown Charlotte, Brandon Hamilton for On Your Side Tonight.